Hello, I'm Joseph from the Global Christian Foundation, which is the center for all solutions. Today, I want to talk about how to quit all types of addictions that is common in our society today, especially with the young generation. So if you are new to this channel and you wish to learn how to quit any type of addiction, please subscribe and hit the notification bell so get notified each time we drop a new video. So what is addiction? Addiction is an inability to stop using a substance or engaging in a behavior or activity even though it is causing psychological and physical harm. Note that someone with addiction will continue to misuse the substance or activity in spite of the harmful effects it has. Cravings, compulsions, inability to stop, and lifestyle dysfunction all point to the existence of some type of addiction. Addiction can be either physical or behavioral, and often they go hand in hand. Though alcohol and tobacco are commonly recognized types of addiction, there are actually hundreds of types of medically and scientifically recognized addictions. Physical addictions are the ones that are generally better known. These are addictions to substances that are ingested or otherwise put into a person's body. Some common physical addictions include alcohol, tobacco, opioids, prescription drugs, cocaine, marijuana, amphetamines, hallucinogens, inhalants, PCP. Nevertheless, physical addictions can generally be grouped into three categories: alcohol, illicit drugs, and prescription drugs. Alcohol addiction is arguably among the most common. It manifests in the form of alcohol dependency, binge drinking, or regular heavy drinking. Alcohol addiction often starts with social drinking and then progresses further and further until one finds him or herself dealing with an unbreakable addiction. Illicit drug addiction is an addiction to illegal substances that cause short-term disruptions in the brain, resulting in an altered perception of reality. Illegal drugs cause long-term changes to the brain and other organs, leading to severe addiction. Prescription drug addiction is using approved medications in any way that has not been prescribed by a doctor. This is becoming increasingly problematic in the United States today. Behavioral addiction is classified as any time that one loses control of their actions in order to engage in behaviors that result in brief feelings of happiness. That person becomes dependent on the pleasurable feelings that come as a result of certain behaviors and begins to compulsively act on that behavior. Some common behavioral addictions include food addiction, sex addiction, internet addiction, pornography addiction, using computers and/or cell phones, video game addiction, work addiction, exercise addiction, spiritual obsession, not to be confused with religious devotion, seeking pain, cutting, shopping addiction, exercise, gambling addiction. Because change is so difficult, it's useful to have a guide when attempting to kick an addiction to drugs, alcohol, or behavior. Today, I bring to you 5 golden principles you can implement to quit any type of addiction. Number 1, make a decision to quit and set a quit date. Your recovery starts with you choosing the future you want for yourself. You have the power to change your life, so make a commitment to recovery. Focus on creating a happy future because you deserve it. It might be helpful to choose a meaningful date like a special event, birthday, or anniversary. Number 2, change your environment. Remove any reminders of your addiction from your home and workplace. For example, separate from those who would encourage you to be involved with the object of your addiction, drug, alcohol, or behavior. If you are trying to quit drinking, get rid of any alcohol, bottle openers, wine glasses, and corkscrews. If you're trying to quit gambling, remove any playing cards, scratch tickets, or poker chips. Also, don't let other people use or bring reminders of the addiction-related substance or behavior into your home. Number 3, distract yourself. Instead of giving in to an urge to use, Come up with alternative activities, such as going for a walk or calling a friend or family member to talk, so that you keep busy until the urge passes. Be prepared to deal with things that trigger your cravings, such as being in an environment where others are using. Number 4. Review your past attempts at quitting. Think about what worked and what did not. Consider what might have contributed to relapse and make changes accordingly. Number 5. Create a support network. Talk to your family and friends and ask for their encouragement and support. Let them know you are quitting. If they use your object of addiction, ask them not to do so in front of you. If you buy drugs, you should consider telling your dealer that you are quitting. Ask your dealer not to call you and not to sell you drugs anymore. Also, you might want to consider talking to your healthcare provider about the method of quitting that is best for you. There may be medications that can ease the process for you and increase your chances of success. If you enjoyed the video and wish to learn more about love, relationships, marriage and other socially related issues, please subscribe to this channel and hit the notification bell so you get notified whenever we drop a new video.